To explain femoral triangle, which is also known as scarpa triangle, and in Latin trigon femoral, and in it's present in anterior region of thigh. It is bounded by laterally sartorius muscles and medially adductor longus muscles, and superiorly it is bounded by inguinal ligament, and floor formed by the like psoas major muscles and iliacus muscles and pectineus muscles and adductor brevis.
Landmark of femoral triangle is anterior superior iliac spine, pubic tubercle and pubic symphysis, medial epicondyle and lateral epicondyle. The projection of neurovascular bundle in femoral triangle is line of Kane, which is drawn from the middle of the inguinal ligament till the medial epicondyle, and the nerve is projected laterally and vein is projected medially. The skin of this region is thin and hairy in males, and there are a lot of sweat glands, and the adipose tissue is loose and contains lymphs, blood vessels, and lateral cutaneous nerves. The arteries are superficial circumflex iliac artery, superficial epigastric artery, superficial external pudendal artery, and veins are the same named like superficial circumflex iliac vein, superficial epigastric vein, superficial external pudendal vein, and the greater saphenous vein and anterior cutaneous vein. The nerves of this region are laterally. There is lateral femoral cutaneous nerve and anterior cutaneous nerve of the thigh, femoral branch of genitofemoral nerve. The fascia here, it is formed by superiorly by the inguinal ligament, and posteriorly it goes as gluteal fascia, and laterally it forms the iliotibial tract, and medially it forms the three intermuscular septum and divides the thigh into three regions. There is extensor compartment anteriorly, and medially there is a adductor compartment, and posteriorly there is flexor compartment. There are two layers of fascia lata, superficial and deep, and there is a opening in the superficial lamina. It is known as saphenous opening through the blood vessel center. The deep one, it forms the compartment. It invests all the muscles, and the lymph nodes here in superficial compartment are projected along the inguinal ligament projection, superolateral, superomedial, and one is projected along the projection of femoral artery, that is inferior inguinal lymph node.
Sartorius muscles, which rise from the anterior superior iliac spine and goes to the medial side on the proximal tibia, and it is innervated by the femoral nerve and blood supply by from femoral artery. And this is the adductor longus muscles, which arise from superior pubic ramus and go to the pectineal line of one femur. And this is the adductor brevis muscles, which arise from inferior pubic ramus and goes to the linea aspera on the femur. And this is the pectineus muscles, which rise from pecten pubis and go to the pectineal line on femur. And these muscles are innervated by obturator nerve, which is a branch of lumbar plexus, and blood supply from obturator artery. And this is psoas major muscle, which arise from the transverse process of thoracic 12, L1, L2, L3 and L4. And this is iliacus muscles, which arise from iliac fossa, and these both muscle goes together to the lesser trochanter, and they are innervated by direct branches from lumbar plexus and blood supply from iliolumbar artery and deep circumflex iliac artery. Now we will see inguinal ligament. Inguinal ligament, it is formed by external abdominal muscles aponeurosis, and it extends from the anterior superior iliac spine, goes to the pubic tubercle. Behind this inguinal ligament, there are two spaces, medial one vascular space and lateral one is muscular space. Vascular space, it is bounded by anteriorly inguinal ligament, posteriorly pubic crest and medially lacunar ligament, and it is bounded by laterally iliopectineal arch, which is present between femoral artery and femoral vein, femoral artery and femoral nerve. And like behind the lacunar ligament, there is a one important anastomosis, which is formed by inferior epigastric artery and pubic branch of obturator artery. And this is the muscular space laterally bounded by anterior inguinal ligament, posteriorly pubic crest and medially iliopectineal arch, and laterally anterior superior iliac spine. and content of this muscular space is lateral femoral cutaneous nerve which rise from lumbar plexus and it innervate skin of thigh, and this is the femoral nerve which rise from lumbar plexus and it give anterior cutaneous nerve of thigh which innervate anterior skin of thigh, and it give muscular branch which innervate muscles and it continue as venous nerve. In vascular space, this is the femoral artery and it gives some superficial branches. This one is the superficial circumflex iliac artery, and this is superficial external pudendal artery. It goes and supply to the perineum, and it also gives superficial epigastric artery, and this is the continuous from the external iliac artery. This is the femoral vein, and in femoral vein great saphenous vein drain, and there are some tributaries of the femoral vein like this one, superficial circumflex iliac vein and anterior cutaneous vein of thigh and external pudendal vein, and they drain into the femoral vein via saphenous hiatus, and femoral vein behind the inguinal ligament continue as external iliac vein. Now we will see there are some deep inguinal lymph node like this, and there are some pelvic lymph node. Now we will see communication of femoral triangle. Superiorly this space communicate with the pelvic cavity like through muscular and vascular space, and laterally it communicate with the posterior gluteal space with the lateral circumflex iliac artery, and medially it communicate with the medial compartment with medial circumflex iliac artery, and inferiorly this communicate with the femoral vessels with the ductal canal. Thank you.